Welcome back to Newsday. The federal government and the European Union have signed 3 landmark agreements to boost local pharmaceutical manufacturing, attract investment, and strengthen reproductive health across West Africa. The deals under the EU's Global Gateway Manufacturing and Access to Vaccines, Medicines and Health Technologies Initiative and SRHR flagships aim to build a resilient health ecosystem by empowering local producers and innovators. The project, enabling local manufacturing of health, immunization and nutrition commodities in Nigeria, quality uplift for advancing local industry in medicine standards, and strengthening reproductive health and rights in West Africa, were announced at the Nigeria-EU Health Investment Forum in Abuja on Thursday. Well, we're now being joined for greater focus on the outcome of that forum by Gautier Mignot, who is EU Ambassador to Nigeria and ECOWAS. Good to have you here on Newsday.
Thank you very much for your kind invitation.
So let's start with the big picture. What exactly is the EU-Nigeria Health Investment Forum, and why is it such an important moment for Nigeria?
Well, it was a one-day engagement with all stakeholders, federal authorities, partners from the international community and private sector, both from Europe and Nigeria, and of course all member states, embassies also, to first present the effort, the impulse that the EU is giving under its Global Gateway strategy to partnership in this sector, health sector, with Nigeria, West Africa, and the whole continent in general. And it was also about signing new partnerships with authorities and also in the private sector. And finally, to have an opportunity for stakeholders to discuss and network between them to advance on new partnerships and new projects and new investments in particular.
Well, thank you for filling us in. We understand some major agreements are being signed at the forum. Could you walk us through what they're about and the kind of impacts they'll have on Nigeria's health sector?
Well, what we're doing through this, through the Global Gateway strategy is really revisit the way we are intervening on the health sector. It's a sector where the European Union has had for a long time a very strong cooperation with Nigeria, for instance, on polio eradication or massive immunization through vaccines, to take just these 2 examples. But now we want very much to articulate all our interventions to foster investment and facilitate investment to develop manufacturing capacities in Nigeria. And this is very much aligned with the federal government strategy through the presidential initiative to unlock the potential of healthcare value chains, the PVAC, with the aim of having 70% of Nigerian needs covered by local manufacturing by 2030, a very ambitious target, but the sector has already been developing over the last few years in Nigeria, and we are partnering very much with all member states. There were several ambassadors also of France, of Spain, of Belgium, Germany. We were there and also signed some of these agreements and are also co-funding some of these projects. And we are also partnering very much with the private sector, of course, and with our development banks, the European Investment Bank in particular, because it's about offering new innovative financial tools, not only grants from the EU and its member states, but also loans and venture debt, innovative and tailor-made financial instruments to help de-risking investment, because this is what has limited investment from EU companies in particular over the last few years in this sector, is the fact that the Nigerian environment and the Nigerian market is still needs many improvement. And so these financial instruments are trying to help de-risk investment and foster investment, and we have already a good pipeline of future investment being under discussion right now. Plus, we have also projects to improve the investment environment, to strengthen the capacity of Nigerian agencies like NAFDAC, for instance, or the Nigerian Agency on Pharmaceutical Research and Development, to make sure that they are up to international standards and with top quality standards in this sector, and also training young graduates, for instance. So it's really exhaustive, comprehensive intervention to strengthen the sector in Nigeria and enable more investments from Europe in particular.
So how does this event tie into the broader partnership between the EU and Nigeria in strengthening health systems?
Well, it's really about trying to combine all of this financial instruments, really tailor-made, aligning with the strategies of the federal government of Nigeria, partnering also with international organizations like UNICEF or UNFPA in this sector, partnering also, of course, with our member states and our development banks, what we call Team Europe. And the new element is this strong partnership with the private sector. We are seeing interest from private companies to invest in production of pharmaceuticals, including generics, but also in medical commodities, in medical clothes. And we are also not, of course, leaving aside sectorial interventions, like, as you mentioned, in sexual and reproductive health, and also in digital health, which is, of course, a very important and new dimension.
Well, that's fantastic. You just touched on the private sector momentarily, but it's often described as a key player in transforming healthcare. How is the forum bringing businesses and innovators into this conversation?
Well, what we're trying to do is really discuss with them and also facilitate contacts between actors in Europe and in Nigeria. And we had, for instance, yesterday also the signature of a memorandum of understanding between Bayer, one of the big pharmaceutical companies in Europe from Germany, and a Nigerian partner on the production of oral contraceptive, to name just one example. But we have a growing pipeline of projects, more than 100 million euros already, and we hope to see it grow in the next few months. And this is really part of an effort which does not focus only on Nigeria. It's really, we are partnering also with ECOWAS and with other West African countries, but in fact with the rest of the continent, under what we call the MAV Plus initiative, manufacturing of vaccines, medicines, and health technologies. It's one of our major initiatives from the EU to help Africa develop its manufacturing capacities, and we see Nigeria as a key hub on the continent to do this. And we want to do this because, first, creating industrialization or helping industrialization and helping to create jobs and opportunities in Africa is also good for us in Europe. Second, because one of the lessons drawn from the COVID pandemic is that we have to develop this kind of local responses, local manufacturing capacities, in particular in Africa. And this is what we agreed upon in the international community a few months ago with the future new treaty on pandemic responses. And finally, because it's also a business opportunity for companies, we see that Nigeria is a very promising market for the future. And of course, we want to be part of this fantastic future of Nigeria's manufacturing sector in healthcare.
So finally, for viewers watching at home, how will all of this translate into real benefits for everyday Nigerians, especially women and young people?
Well, it's very important, of course, healthcare for any population to make healthcare and health products accessible, affordable, and of good quality. And this is what we want to help develop. And we do this also through a sectoral intervention, for instance, in sexual and reproductive health. What we want is to enable families, couples, and women in particular, and to have access to the best level of services, to reduce maternal the rate of maternal death, at delivery, and also limit the number of unwanted pregnancies by adolescent girls. This is one of the sectoral examples that will benefit really to the people. But more generally, if products are manufactured in Nigeria, it will create jobs, opportunities for Nigerians, young Nigerians in particular, and it will help also reduce the cost of medicines and have better medicines in which people can really trust and avoid buying medicines cheaper, but which are sometimes fake products and which can be even harmful for people.
Ambassador Gautier, Mignot, we'd like to thank you for this insightful interview and your time here on Newsday, and many thanks for the good work that you're doing.